My name's Greer Hill. I'm the Director of Student Services, Safeguarding and Support here at Suffolk New College, and I'm also the college's Senior Mental Health Lead, which is why I was so keen for us to mark this week in maybe a different way to how we have done before. So the college has an early help mental health officer who works within the Student Services Directorate, a lady called Carmela Pugh. She's been with us for just over a year now, and she's coordinated, in fact she's led on this week's activities. We've had a number of workshops and sessions delivered by some really big organisations, big in terms of mental health practice and mental health support. So we've had Suffolk Mind, Suffolk Wellbeing Service, we've had Cooth, we've got the Terence Higgins Trust who have been in to deliver a workshop, we've had Yana, we've also had some more interactive sessions to support our students. So we've had a company called Rock Paper Scissors, they're local, in fact just around the corner from the Ipswich campus, who've delivered an art-based programme for us, which is actually underpinned by Suffolk Mind's emotional needs met model. That's gone down really well with our students, along with Pets as Therapy. So this is a national organisation, other people might know as the Pat Dogs. And so we've had the dogs over at the rural campus and also the Ipswich campus this week. We have campus over in Halesworth, which is part of our On the Coast provision, and they were supported this week by the Walpole Centre, who were able to support us with some counsellors came out and looked at meditation, hypnosis, and that kind of thing, and that's also gone down really well with the students over there. I guess it's helpful probably because we're at the end of the week for me to reflect a little bit on what this week has been like. So as I said, we've not marked the week in quite this way before, and we recognise as a college that our young people, our learners, just as every other college up and down the country, COVID has turned their lives, many of their lives, upside down, and mental health is at the forefront of how we need to respond and how we need to support. And it's been just brilliant this week to see how our external services have come together to support us, to deliver workshops and interactive sessions. They've been talking about self-help resources, how our learners can check out themselves really what might be available. Our message is it's never too early to reach out for support effectively, and that's something that Carmela has been developing for us within an early help mental health pathway. So this week to see that learners have been accessing, as I said, these workshops, these activities, hearing from experts about, you know, when to look up at a website, when to look up at a resource, what apps maybe they might be able to download, how to take care of themselves, breathing exercises, that kind of self-reflection. Some of the sessions we've had this week also included kind of yoga in your chair, and how cool is that as part of a response to look out for your own mental health. We've also had some learner-led activities this week, and we were really lucky. Some of our level 3 year 2 learners put on a music gig. It was a fundraising gig actually in support of Suffolk Mind, and one of the Suffolk Mind members of staff was actually able to enjoy it while she was here. Then we've had some learners from beauty therapy put on massage and nail painting, something really relaxing. Today I guess it's quite fitting, so this morning we had the first GCSE exam that hundreds of our learners have been or will have sat this morning, and our lead chaplain, Reverend Linda Pepper, she's been around on site at Ipswich today to just kind of be there and be available and be in ear for anybody that wants to check in. As I say, this week for us it's been really a recognition that we need to do as much as we can to support our learners as early as possible. We want to break taboos Everybody says that, don't they? Break media stereotypes, break those judgments, enable conversations, start a conversation. A message that has really resonated with me this week, which has been shared from one of the YANA sessions. So YANA stands for You Are Not Alone, and they're an organisation that support within the rural community, agriculture in particular, in recognition of the levels of mental health and higher than average suicide rates in terms of that really acute level of distress. Their message to some of the groups this week has been, you are our future. We need to empower our young people to be able to have a conversation, lean on a friend, talk to a friend, and for all of us to acknowledge that that it's okay not to be okay. And in fact, talking about leaning on a friend and talking to a friend, this week has given us the chance with an external organisation called Student Life. They're a student-led, not our students, but a young person-led platform. And they've been building quite a reputation, a really good reputation for supporting young people to support other young people with regard to their mental health. And we've been able to use their support over the last few months to launch a student mental health ambassador programme. It's something that I started with Richard Stewart from Student Life before COVID. Before COVID, can we even remember what life was like? And here we are 3 years later, and we've got our first group of learners who said that they want to be supported and developed to be student mental health ambassadors. And so that's what we're going to be working through with them now into the new academic year. I guess to close, the message really that I would give would be seek help, reach out, talk to anybody across the college. We've got designated members of staff, of course, who learners might feel more compelled to talk to. Progress tutor, student support, somebody in the learning curve, maybe one of the chaplains. But for us, if there's a connection, if it's a member of staff on reception that you feel most comfortable talking with, then that's the person for you to develop that kind of conversation with, and they can then signpost and support. And ultimately remember, your mental health matters and you're not alone.